Welcome to Dr. Brumfield's Elite Athletics. I am Dr. Brumfield. Plantar fasciitis, ooh-wee, ooh-wee. How do you treat it? So plantar fasciitis, ooh-wee. If you haven't watched the first video of plantar fasciitis, go back and watch what's the cause, right? This is part 2 of the video. Today we're going to talk about how do we treat that blasted plantar fasciitis pain. Ooh-wee, it hurts, right? I've experienced it. I'm sure many of you have experienced it. So before we get started, we need to make some clear goals for our treatment, right? We don't want to just treat to treat and not having a really clear objective of why we're doing what we're doing. So the first thing is we want to promote soft tissue healing. So for those of you that may have forgotten, remember we're talking about the plantar fascia right here. Again, it is soft tissue. Yes, it is attached to bones, but that's one thing. We want to promote the healing of that. Second one, we want to relieve the pain and also decrease the chances of reoccurrence. The other thing is, as we talked about, is remember we said that plantar fasciitis pain comes from the shortening of the plantar fascia as well as it being cold. So we want to make sure we increase the range of motion, so that way now when you put your foot down on the floor for the first time, it's not that dreadful pain, right? It's a normal gait, right? And the last one, we want to restore the normal strength and integrity and stability to the joints, especially all the joints, but mainly so that we can take care of this plantar fascia. We want to make sure that it's healthy and not lighting us up, because it will light you up. All right, so when we're talking about, I guess I need the foot, right? So when we're talking about treatment, options for plantar fasciitis, there's a few things that need to come to mind. Is it an old injury or is it a chronic injury? Meaning, is it an acute injury or is it a chronic? And I will also remind you, there's a video on ice versus cold, right? So we need to know, when do we use it? There's a video on ice versus heat, so take a look at that if you're a little concerned or you need a little bit more in-depth reason of why we use each one. But again, for acute 0 to 72 hours, our method of choice is going to be ice. Because remember, we're dealing with an acute injury, we have that inflammation, and we want to make sure that we're decreasing the inflammation. And so in that video as well, I talked about an ice bath or an ice massage. And so that's simply having a styrofoam cup, filling up with ice, letting it freeze, peel off the top, and then you can take that cup, if this was a cup here, and just massage that area. Okay, that's the old football way that we used to do. And so you can also get one of these ice rollers here, and as you see, you can actually roll your foot back and forth again. And because this has been frozen, right? So if you can see, let's see, can you see, or maybe if I touch it, right, you can see the moisture on it, right? So this is actually a frozen ball, but that will actually help, one, to decrease the inflammation, as well as to help you with the range of motion, because we want to increase the range of motion. Now, when we're talking about a chronic plantar fasciitis, we're talking about it's over 4 days old or 3 days old, right? So we know that it's there. It's not going anywhere unless we get involved with it, right? So at this time, I would talk about massaging. And so massage is important. So here's the plantar fascia. I'm going to prop it up. And so you see that it runs, the foot's here, right? So it's running the width of the foot. What we want to do is deep tissue and get in there on that fascia, and we want to push in and kind of roll in. That's just to get the foot warmed up. And then you can do something that's called cross friction, right? Get in there right on it. Now, it's going to be painful, but once it's done and it's done correctly, then you're going to get a lot of relief for it. The other thing that I like to do is pull the toes back. So if my patient is on the table and the feet are hanging off the table, I like to pull the toes back, which would make this plantar fascia more pronounced and straight, and then I can go in there and really work on it and get in there. Now, let's say you're at home and you have no one to rub your feet. So we want to make sure that you can still get the treatment that you have. Maybe you have a little massager here. And so it's the same principle. Based on tolerance, well, let me stop this for a sec. Based on tolerance, you may want to use the flat tip, or you may want to use the round. In fact, let's use the round tip. You may want to use the round tip because the foot has that semi-arch, right? And so now you can go in. Of course, yours doesn't sound like this. You have tissue, muscle, fat, everything to absorb the sound, but this is just bone, right? So it sounds a little bit worse than what it is. But so what you, let me see if I can stabilize it a little better. So what you would do is get in there and really massage that plantar fascia so that you can see what I'm doing, right? I'm at the base and I'm really going back and forth, back and forth. And then if you need to, you can change the intensity. Now, that's for the brave right there. But you want to figure out where you are in terms of tolerance. In terms of how aggressive you want the massage, how aggressive you want the massage gun to be, right? So that's something to consider. The other thing is stretching. If we take this foot again, you can grab a towel, wrap it around the toes, and just pull the toes back, and it's going to stretch the plantar fascia. Because again, one of our main treatment goals is to increase the pain-free range of motion, which means we want to be able to move our foot in all different kinds of ranges without having pain, right? And so remember, initially when we talked about it in the first video, is that the reason we have the pain is because the plantar fascia has shortened and or got cold. And so how does something get cold? It's because it's lack of use. You've sat for 20 minutes, 30, 40, 50 minutes to maybe an hour, and now it's shortened and it's cold, so now you have to heat it back up, right, as you walk and go on and get started. So that's a stretch. The other thing is you can do is if my hand is the floor and here's the wall, you can go and press your foot up against the floor, right? Up against the wall, because you want to bring those toes back. But I think initially, to be on the safe side, just go ahead and pull the toes back. Now, that's stretching. Another option would be, and this is, so I'm talking about this now from a clinical setting, is we would do what's called cupping. So again, here's a silicone cup where you can put it on the area and let go, and it would help you with the inflammation in there, and you would have a cup here, here, and here. But again, that's a clinical setting. Some of you may have cups, so you're more than welcome to do the cups. And I'll do a video on the proper use of how and why to use the cups as well, so look out for that. And then the last one would be just to apply KT tape. And so KT tape is really effective to help stabilize the medial, the lateral, arches of your foot, and actually all arches of your foot, and then that way with the KT tape it'll help you to stabilize a little bit better and take the pressure off of the plantar fascia. So what we're going to do here, this is a little different for me, but I'm going to show you how to tape up the KT tape. So first and foremost, let's move this out to the side. We're going to take the tape and we're going to make some small cuts in it. You can also buy the KT tape with these strips already in them. But for our purposes, I just want to show you how I do it in the clinic. And normally this is done already ahead of time, but we're going to make it happen. There we go. You want about 5 strips. Hopefully you can see this because I'm not able to see the camera, but I'm just trying to give you a real life application here. And then one last cut. Can we see? I think so. I'm gonna move it back a little bit. Uh-oh, had a casualty with the tape. As we tape. All right, there we go. So now let's bring our plantar fascia back over. Have to prop it up, right? So let's bring our plantar fascia back over. Let's prop it up. Now, with this, I'm going to tear off a little piece. Actually, I'm going to cut it because this isn't an actual foot. So I'm just going to kind of give you the idea. So we're going to tear along the edges of each tape, each split, like this. So that way you get a great point of view. You're looking at what I'm looking at, okay? And then from there, we're going to tear off the base of the tape. Now, make sure that you don't touch the tape. We're going to place it on the heel like so. And we want to make sure that, of course, your heel is going to be a little bit wider because you have the skin, you have the fascia, and all that other stuff. So one piece at a time, and this is much longer than what it should be again. And we're going to go down the course of this foot. That's the big toe, right? Then we're going to go tear off another piece. And we're going to give it a little bit of pressure, 100%, drop it down. And we are going to go all the way down there as well. Now, we're going to go again. Pressure, full release, down the toe. All right. And we're getting a little tricky here. Again, pressure, tension, release it, run it down the fascia as well. And then the last one here, let's see, hopefully you guys can see this. There we go. And then you stretch it as well. Uh-oh. Stretch it as well. Bring it down a little bit. And there. So now, once you have all the pieces onto the, trying to move it a bit, onto the plantar fascia, you want to take the back of the tape and you want to work it in because the tape is activated by heat. Now, the only difference is I would cut these and pre-measure them before they get to this length, because they don't have to be at the length, and I'm not sure if you can see the full length of the toes. Let's see. There we go. They don't have to, the tape doesn't have to come all the way up to the full length of the toes, but right about here at the base of the metatarsals, or at the base of these toes. So that's how you would tape for kinesio tape for plantar fasciitis, okay? And so again, make sure you massage it in, activate the tape, is activated by heat, and then that way you are all set.